Well, we all know about the success story about Bhilwara. Till the end of March, it had become the hotspot, which one of the largest number of cases in any district in the country. And then suddenly we saw a turnaround. We saw, and now it's been days since any fresh cases have been reported from there, and many people have recovered. With me, one of the young officers of Bhilwara, and someone who's really actually quite known in the headlines, Tina Dabi. She was the IAS Topper. She's from Delhi's Lady Shri Ram College. And so she's here with us. Thank you, Tina, for speaking with the Hindustan Times. What's it like? You pass out in 2015 and you're in the middle of the most talked about area in the country. Tell us what it's like.
Well, thank you so much for having me, and it's wonderful speaking to you. And thank you again for complimenting on the good work that we've tried to do. Let me begin by telling you that even we were taken back by surprise that we would be compared to be the next Italy, or we would be described as the coronavirus hotspot. And preparations were in place like any other place in the country, since because ये वाली जो कोरोना वायरस का जब से ही the whole situation was coming up, like I think back in January. Since then, we had what would we say, some basic measures in place. But one fine day on 19th of March, if I'll be specific, we got our first positive case. And it was on 20th March that when we connected the dots and we found out that it was one whole private hospital which could be suddenly the epicenter of the whole crisis. And I am posted as city SDM in Bhilwara since October 2018. So it's been quite some while that I have been posted here. And I was the person who went on the spot, the administrative officer who went along with a team of doctors to that hospital. And within a matter of 2 hours, the collector of our district, Shri Rajendra Bhatt, took the very stern and firm decision that we need to go for a curfew, we need to go for a complete shutdown. And within a span of 1 hour, as soon as that order was passed, I remember going around the whole city, shutting everything down, convincing people, even scolding a few people, requesting them, persuading them, telling them not to panic. And within a day or two, we had to work out all the systems to ensure that people are not inconvenienced, because you can understand that suddenly there's so much panic. किसी के घर राशन नहीं है, किसी के घर fruits, vegetables nahi hai, medical supplies have to be ensured, family exigencies. Like for the first 3-4 days, we were receiving panic calls from everywhere in the city and from the district that, oh, my daughter is stuck there. This is a family emergency. I was here for a wedding and now, I'm stuck here. I'm from some other place. So we had to tackle so many things. But we always took it as a matter of pride that, we are doing national service. This is a time of a public health emergency. And no matter how hard it gets, how tough it gets, we have to take it heads on. And I can tell you from personal experience that for the first week, say from 20th March to 27th March, we had absolutely no idea of day, night, time. We were running around, we were managing everything, because now we had just one mission in mind. We just had one target, that we just need to stop it. We were sitting on a ticking time bomb where it could reach any number. It was actually a possibility of massive community spreading.
And so when was the time that you finally got a breather and said, okay, things are improving, I think we can relax and maybe get a night's sleep now?
Well, it took a week, because you have to really manage a lot of things on ground. Well, it's it's very fine and all right to say that, okay, complete lockdown, complete shutdown, but how do you get things moving? People will never cooperate, the public never cooperates if you don't take care of the essential supplies, the essential services. And working that out, it was a nightmare for my district collector, for the entire team. But we worked really well under his leadership. It was decided that nothing doing, we can't risk even opening the ration shops, the grocery stores. We have to ensure door-to-door supply. And somehow we roped in the cooperatives, the Krishi Upaj Mandi, we roped in the DSO, we roped in everybody, all line departments. But no, the administration and the police have to do everything. And we really did that. We are now doing door-to-door supply of fruits and vegetables, even milk supply. We have tied up with Saras, and they are doing that. And
Ms.
we are
Dabi,
giving.
would you tell me of one particular person that you handled who was the most difficult?
So there were people lining up at the collectorate, and which was scary also because we want social distancing, but there were people, no, that my wife is pregnant, she might deliver, I need to go. And it was very hard convincing him that we are doing this for your own safety. We have absolutely no intention of hurting you or, preventing you from your happiness or your family. But so those were tough cases, I think, because when people are emotional, it's very difficult to make them understand that these are tough times, and you really need to understand that. There were a lot of students who were stuck here, and there were parents that we want to go and bring them. Ab wo kaise allow kare? When we are facing such a thing, we of course gradually permitted that, and we saw that whether it would be possible. But tackling such cases where people are very emotional, that is particularly very hard for me even personally.
So I wanted to ask you that now everyone, we saw the hard lockdown, Bhilwara and Rajasthan have it before other parts of the country. Now they're talking about extending it even further, even after the 15th of April. What do you think about that? And what would you like to say to, the rest from one hotspot place to the other place parts of what would the message be to everyone else?
Well, that's a very good question. We personally, as you might be aware, PMO has been asking for feedback across the country from all field functionaries, from all, especially those districts which are facing this crisis on a larger scale. And we have also recommended that the lockdown should be extended. I'm saying this because we really don't know the current status of the virus and how it's going to pan out. We must accept that we are slightly clueless about that. But what we are really sure is that social distancing is what can really, really avert the crisis. And for social distancing, the thing which can only be done administratively is going for a lockdown and a shutdown. And what you started this interview with, that everybody was earlier scared of Bhilwara and now everybody is appreciating Bhilwara, it's because we ensured we did it very well. The implementation procedure of this complete shutdown and lockdown, we convinced the public, though it was difficult, but it took a while, a short while, say 4-5 days, but now the public is cooperating. They finally understood कि ठीक है जो कर रहे हैं शायद हमारे लिए ही कर रहे हैं. It has some advantage, it has some benefit for us. So it's this social distancing which can only be maintained administratively through a curfew, lockdown, shutdown, whatever the case, whatever the degree of severity we may be facing. But this is the way out, and that's why we are recommending for it. But at the same time, since I am one of the field functionaries and I know that at the ground level there are so many different problems. So with this complete shutdown and lockdown, there has to be the essential supplies, the essential services have to be kept running. Without this in place, people would never cooperate. Your lockdown measures would fail within a day or two, and then it will be of no use.
So basically food, you have to ensure people get food. You have to ensure, they get medicine access. Without that, it's a disaster.
Absolutely. And you have to also ensure that if there is an emergency where you need to move, so you have to consider those cases on a case-by-case basis, because of course there might be some exigencies. It can't be, you can't totally avert your eyes from that. So you have to keep yourself open to that possibility.
Well, thank you so much, Tina Dabi. I think even though it's early yet, and you're only, I think, 25 years old, but I guess you would agree that this is going to be one of the most challenging assignments that you're going to face as an IAS officer, right?
Thank you so much for saying that. Of course, as positively as I can put it, it is a lifetime opportunity. We never get this opportunity to serve so many people, to handle crisis of this magnitude. And I think the learning experience that would come from it is going to be very rewarding for me throughout my career. So it's great, and I'm looking at it as a matter of pride.
Thanks, Tina. Thank you very much.